Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Vaginismus. Getting vaginal pain validated and seeking treatment. Vaginismus is when vaginal muscles tighten involuntarily, causing painful or difficult vaginal penetration. It can affect your experience getting pelvic exams, menstruation, sex, and your mental health. Research estimates between 1% and 7% of women have vaginismus, but this is likely a low estimate due to underreporting. Experts estimate that the prevalence is closer to 17%. Treatment options are advancing, and about 71% of people with vaginismus find relief with treatment. /r/n/r/n illustration by Mira Norian for Verywell Health /r/n/r/n Vaginismus means your vaginal muscles tighten without you wanting them to, making penetration with a penis, finger, tampon, or speculum painful or impossible. It can be something you've always had or begin suddenly. /r/n/r/n During vaginal penetration, you might feel sharp, burning pain or tight pressure. Some describe this as hitting a wall. It can occur at the entrance or deeper inside the vagina. /r/n/r/n Pelvic exams can be painful or impossible for those with vaginismus. Consider asking for a pediatric speculum, longer appointments, or a muscle relaxant prescription if this is the case. /r/n/r/n Inserting tampons or menstrual cups can be painful or impossible. Many people think this is normal, but using a tampon shouldn't hurt. Not being able to use tampons can be frustrating because using pads is tricky for activities like swimming or gymnastics. /r/n/r/n Vaginismus causes pain during attempted penetration, making sexual intercourse or masturbation impossible. Worrying about the pain can also cause panic attacks. The effect of vaginismus on sex can strain relationships because you might avoid sex, or your partner might be afraid of hurting you. /r/n/r/n Struggling with vaginismus can make you feel like a failure, leading to feelings of inadequacy and shame. These feelings can create a cycle of isolation and guilt, which might lead to depression, panic attacks, or deep sadness, especially if it affects your hopes of having a family. /r/n/r/n The causes and triggers of vaginismus can be physical, emotional, or psychological. Symptoms can start at any age and may not always have a clear cause. Some people experience symptoms with any insertion, while others have issues only with certain partners or during medical exams. Risk factors include /r/n/r/n Providers typically diagnose vaginismus when you have the following symptoms lasting 6 months or more. /r/n/r/n Your provider may also perform a physical exam, imaging tests, or a urinalysis, peeing in a cup, to rule out the following conditions that could also cause painful sex. /r/n/r/n The following relaxation and breathing techniques can reduce muscle tension and improve vaginismus symptoms. /r/n/r/n The following pelvic floor relaxation exercise can also help. /r/n/r/n Kegel exercises strengthen weak pelvic floor muscles. However, vaginismus involves tight muscles, so reverse Kegels may be a better choice. Here's how to do them: /r/n/r/n Vaginismus is a treatable condition that often requires a treatment team, including gynecology providers, pelvic floor therapists, psychologists, and sex therapists. /r/n/r/n Psychological counseling addresses emotional and mental challenges. A sex therapist can teach you about /r/n/r/n A pelvic floor physical therapist can guide you through exercises and exposure therapy, gradually inserting your fingers or vaginal dilators into the vagina. Vaginal dilators are devices that help stretch the vaginal wall, making penetration more comfortable. /r/n/r/n The following medications and procedures can also help. /r/n/r/n Living with vaginismus can be challenging. Consider connecting with others who understand through support groups or online forums. If you are beginning dilator treatment, be patient with yourself and go at your own pace. It can be more emotional than you might expect. Here are a few other vaginal dilator tips. /r/n/r/n vaginismus is when the muscles around the vagina tighten, making penetration difficult. Symptoms include pain during sex, trouble inserting tampons, and difficult or impossible pelvic exams. Underlying causes can be physical and psychological. Living with vaginismus can be frustrating, but many people get relief with self-care or medical treatments. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.